First witness today wishes to be known as Stuart, does he?
Yes, sir.
Stuart, please.
Please state your full name.
Stuart Michael Mclean.
Take the book in your raised hand and repeat after me. I swear by Almighty God
I swear by Almighty God
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
Stuart, you suffer from Ehlers-Danlos syndrome.
Yep, that's correct.
Can you tell us a little about what that is?
It's a connective tissue disorder, and it's like my joints rub bone on bone.
And common symptoms can be bruising, fragile skin which bruises easily, and hypermobility.
That's right, that's correct.
And you have what's called classical Ehlers-Danlos syndrome type 3.
That's right.
It's not a blood clotting disorder.
No,
And there's no specific treatment for it. It's about managing your lifestyle and activities to try and avoid causing damage.
that's correct. You just manage the pain.
But you were treated with factor VIII in 1978 in a potentially mistaken belief that you had a blood clotting disorder.
Yep, that's correct.
And as a result of that, you were infected with hepatitis C.
Yes.
Well, we're going to look at quite a lot of the correspondence that you've exhibited to and referred to in your statements to try and explore how that came about.
No
But
problem.
we'll start in 1971. You were 2 years old and you underwent an adenoidectomy, the removal of your adenoids.
That's correct. Yep, I did.
And what, to your mind, and for the purposes of your evidence, is the significance of that?
That procedure, what I've now led to believe in later years, if that was carried out on a haemophiliac patient, that they'd have had to have intervention because of the nature of that operation, and then obviously the bleed out that can happen. And I never had to have nothing.
There was no unusual bleeding, no complications, no cause for concern, no requirement for treatment in relation to that surgery.
Absolutely nothing.
But it was noticed in your early childhood, the first few years, that you bruised very easily.
Yeah, I did. But what boy doesn't? Who's fighting and playing around and everything.
But you were referred to a paediatrician at West Kent General Hospital, and that paediatrician thought the bruising could possibly be explained by a bleeding disorder, and so he referred you to a consultant haematologist at the Lewisham Hospital, Dr. Holman, who did some investigative tests in 1976.
He did, yeah.
But those tests were normal.
Completely normal.
In 1977, because you didn't live in the area of the Lewisham Hospital, the consultant there proposed to transfer supervision for any care or treatment that you might need to a consultant haematologist at West Kent General Hospital, Dr. Nalinda Naik.
That's correct.
And we'll just look at one document in that regard to start with. Henry, it's 0653003, please. We can see it's dated the 4th of April 1977. It's a letter addressed to your GP. And we just need to look at the last paragraph, please, Henry. It's a rather long way for the family to come here, and Maidstone now have a haematologist, Dr. Nalinda Naik, who is interested in defects in blood clotting. I wonder whether it would be easier for them to see her if any further episode arises. So you were transferred to Dr. Naik because it would seem from here her interest in defects in blood clotting.
That's correct, yes.
Now, if we have up on screen, please, Henry, 0653005. We can see here a letter dated the 31st of August 1977. It's from Dr. Naik to the Oxford Haemophilia Centre. And it says this, in the first paragraph, it refers to a long history of repeated bruising, hemorrhage, reference to being seen at Lewisham, who thought his coagulation screen was normal, and various other matters there set out. And then Dr. Nike says this in the second paragraph: I think this boy suffers from von Willebrand's disease. I discussed him with Dr. It's not clear what the name is there, Matthews, it might be, a little while ago, but the parents were rather reluctant to bring this boy to Oxford unless they have to. I therefore decided to request you to carry out a preliminary factor VIII related antigen test, and then if you can confirm my findings, then I will persuade the parents to visit you. And she refers to enclosing a citrated plasma example taken on the 22nd of August 1977. So we see there set out, I think for the first time in your records, a doctor's belief that you suffered from a form of bleeding disorder, von Willebrand's disease.
I struggle with that, considering Lewisham Haemophilia Centre said everything was normal. I don't know why she hasn't taken notice of Lewisham, but is requesting more.
And then if we have 06530006, please, Henry. We can see a letter in response from Dr. Ritzer at Oxford Haemophilia Centre to Dr. Nike, dated the 13th of September 1977. It thanks her for the sample of plasma. It refers to the results of your tests and says this: in view of the fact that the samples were taken on the 22nd of August and arrived here in the frozen state on the 1st of September, I do not think we can attach too much significance to the level of factor VIII coagulant activity which we found. With regard to the factor VIII related antigen, Stuart's level is below normal. We should be very pleased to see the patients if you wish and if you can persuade them to come. So 2 results there set out, one no significance attached to, one in respect of which it said your level was below normal.
That's correct.
If we then please have up on screen, Henry, 06530007. We see here on the 18th of October 1977 a further letter from the Oxford Haemophilia Centre. This time I think it's from Dr. Matthews to Dr. Nike. And clearly by this time you've been seen at Oxford. We can see that from the first sentence. I saw Stuart on the 23rd of September 1977. It refers to a reference to a large hematoma and some incidents of bruising in your knee. And it expressly refers to having your adenoids removed without problems. And then says this in the last sentence: our tests on Stuart, the results of which are enclosed, are completely normal. And there is no reason to suspect from them that, first to someone else that we're not going to go into, but that you suffered from any specific coagulation abnormality. If Stuart suffers excessive bleeding in future, it might be worthwhile reinvestigating him to see whether a defect exists at that time. So you're seen at Oxford.
Yeah.
Dr. Matthews investigates, undertakes tests, notes the adenoid surgery and the lack of problems, and says the results are normal, no reason to think there's any coagulation abnormality.
Yep, that's twice Lewisham, which was the lead haemophilia hospital in the South East, and now Oxford, which I believe at the time was the lead in the UK.
But if we look then at 06530008, this is a letter 9th of November 1977. So it's about 2-3 weeks after Dr. Matthews at Oxford has written to Dr. Nike. And it's addressed to your GP. It refers to the fact that she'd sent you to Oxford for further investigations. And then it says this in the second paragraph. Meanwhile, I have carried out repeatedly factor VIII related antigen on Stuart. It then sets out her finding and says this: if we are right, I suspect that Stuart has von Willebrand's disease. Since the king of clotting does not support my hypothesis, I can only suggest that in future, should Stuart have excessive bleeding, tooth extraction or planned surgery, my hypothesis should be borne in mind to prevent any unexpected hemorrhage. The effective treatment is simple by giving fresh frozen plasma or cryoprecipitate. Do you know who Dr. Nike was referring to when she talked about the king of clotting who did not support her hypothesis?
I, looking at these, presume it was either Dr. Matthews or Dr. Rizzo.
At Oxford Haemophilia
Oxford
Centre, where you've been
Haemophilia.
sent for specialist investigation.
That's correct, yeah.
Now, in September of 1978, you fell and you injured your knee. And you were taken to West Kent General Hospital, and your statement explains that you were treated by Dr. Nike and you were given fresh frozen plasma, you were given cryoprecipitate, and you were given factor 8 concentrates. As far as you are aware, was that the only occasion when you were given factor 8 concentrates?
At that time, yes.
And then if we look at 0653009, we can see this confirmed in a letter from Dr. Nike dated the 6th of September 1978 to a consultant orthopaedic surgeon. And it says this. It refers to, it's not a terribly good copy, but it refers to on, I think, a date in September, he came to see me for a possible hemorrhage in a knee joint, which took place over the weekend of the 2nd of September. I gave him prophylactic treatment with fresh frozen plasma, cryoprecipitate and factor 8 concentrates over 3 days. At least there was no further continuation of blood loss in that joint. So just pausing there, in circumstances where the Oxford Haemophilia Centre have said no evidence of a clotting disorder, and this letter says that what you had in your knee was a possible hemorrhage, you have been treated on a prophylactic basis with not one but 3 different types of treatment, including factor 8, which hadn't even been the treatment referenced in Dr. Nike's own letter to your GP the previous year.
And the previous letter, referred to using that only if there had been excessive or extensive bleeding, which there wasn't on this occasion, from what you say, and nor is there any record that there was.
No.
And you say in your statement that you have no explanation as to why Dr. Nike treated you with clotting agents in the first place. And you say this, I have no idea, and nor does any other medical professional I have spoken with, why she would treat me with all 3 products.
That's correct. Can I just say something on there which, if you're a priest or you're a vicar, you go by the Bible. These doctors go by the medical journal. DDAVP was available in 1977. Possible. There's no evidence from Oxford or Lewisham, but possible. That is just, there's no way to explain it.
Well, Stuart, you've anticipated my very next question, which is you'd say in your statement that even if you had von Willebrands, which you didn't, DDAVP would have been an available treatment in that event.
Yeah. There's also something else where there's a letter previous what you pulled up on screen where this doctor had an interest in bleeding. I find that a bit different to being an expert in bleeding.
And you've observed in your statement that what causes you such anger is that in 1978 the doctor chose to treat you with, and these are your words, not mine, every blood product she could get her hands on, rather than the entirely safe alternative of DDAVP, which would have been perfectly suitable had her belief that I suffered from von Willebrand's disease been accurate.
Personally, I think she went into the storeroom and thought, let's have one of these, let's have one of these, and for good measure, let's have one of these. There's no other explanation after hearing all the other people's stories.
The following month, you were given more cryoprecipitate in October of 1978, but not on that second occasion, factor 8.
Was that given prophylactically, or was it given actually in response to a bleed?
The copy we have is rather poor and quite hard to tell, quite hard to read. Talks about having a further injection of cryoprecipitate within the last 3 days, and there's a handwritten note given more cryoprecipitate. So I'm not sure, without seeing whether we can get a better copy than the document that's exhibited to Stuart's statement. Do you happen to know the answer to that, Stuart?
No.
Okay. Well, we may be able to find out. And I know we've got better copies of a number of your records than we have here. Now, in 1980, your care transferred to a different haematologist at the West Kent General Hospital, Dr. Williams.
Yeah.
And if we look, please, Henry, at 065312, we can see there a letter dated the 9th of May 1980. It's written by Dr. Williams to your GP, and it says this in the second paragraph: clotting tests have usually been normal when they have been done at Lewisham, Oxford, and here during Dr. Nike's time. I feel quite sure that he has a mild form of Ehlers-Danlos syndrome, in which easy bruising is well recognised and is due to a fault in the collagen. The platelets, which are normal, adhere poorly to this faulty collagen, hence the bruising. And then he says this: the wind was somewhat taken out of my sails at this point by discovering that Mr. Stossel, I think it is, had previously reached this conclusion as well, and had quite rightly decided that no action need be taken other than the avoidance of undue trauma during games. And then there's a reference to checking your bloods again, and apart from a slightly long bleeding time by a sensitive method, all the results were within our normal range. So this, I think, is the first reference in the documents that you provided to the inquiry from your records of Ehlers-Danlos syndrome.
Yeah.
And that's May of 1980. And that is a diagnosis that later in life has subsequently been confirmed. That's what your doctors...
Oh, sorry. I knew that.
I'm glad it's you and not me, Stuart.
Sorry. I thought I turned it off. Sorry.
That diagnosis of Ehlers-Danlos syndrome has been confirmed by the clinicians who have continued to treat you over the years.
Yes, I didn't know until about 10 years ago what actual type I had until it was confirmed.
Now, if we then move on from that letter 5 years to 1985, you were referred to a Dr. Graham, a consultant rheumatologist at Guy's Hospital, because you've been having pains in your knees.
Yeah.
And we'll just look at that letter briefly. It's 065313, please. And it seems that the issue of von Willebrand's still hasn't completely disappeared, as it were, from your medical records. So this is a letter 26th of July 1985. It's from Dr. Graham to Dr. Williams. And in the third paragraph on the bottom of the page, it refers to there being tenderness attributed to Osgood-Schlattler's disease. That's extreme growing pains, is your understanding of what that diagnosis was. And then it says this: he has an interesting hereditary connective tissue disorder which is difficult to classify clinically. He has many of the features of the Ehlers-Danlos syndrome, but there would appear to be overlap features with Marfan's too. And then it says this: I was also not clear whether you attributed his bleeding diathesis to the EDS or whether there was another explanation for it. I note that he had written von Willebrand's on his card, but this may be an out-of-date diagnosis. I would be grateful if you could enlighten me on your current thoughts in this regards. And then he goes on to deal with the issue of a sudden growth spurt. Do you know what the reference was to the card with von Willebrand's written on?
I don't know about other haemophiliacs, but I was given it, and on the green card it had haemorrhagic state. And it was a special medical card that if I had any bleeding problems, I'd get treatment at a specialist centre. And I do believe that is given to haemophiliacs. So
you'd been given that, although the fact that the suggestion that you had von Willebrand's appears to have been ruled out by those who had undertaken the necessary tests.
Correct. By Maidstone, not by Oxford or Lewisham, but by Maidstone.
Now, later in that year, in September of 1985, Dr. Williams referred your case to Dr. Savage at St Thomas's Hospital. And could we have on screen, please, 065314? And so here we see Dr. Williams suggesting to Dr. Savage in the first paragraph the following: I'll be most grateful for your assessment of this patient. He has connective tissue disorder with features of both Ehlers-Danlos and Marfan syndromes, and over the years has suffered from numerous bleeding episodes. Just pausing there. As far as you're aware, had you suffered from numerous bleeding episodes over the years?
Nothing.
You'd had the bruising, you'd had the knee problems.
I'd had 4 teeth taken out the back when I was younger, and one did bleed, and it kept bleeding, so they plugged it and it fixed it.
But you're not aware of anything else that would fall within the scope of a description of numerous bleeding episodes?
No.
And then it says this: I've never been entirely happy that the hemostatic disorder is only due to the connective tissue disorder, and I think he may have von Willebrand's disease. So you put it this way in your statement, Stuart. In this letter, Dr. Williams resurrects the idea that you may have von Willebrand's disease and asks Dr. Savage to investigate it.
Definitely. I struggle with this because when I was younger, I had green stick fractures, and I broke my leg, I broke my wrist, ankle. No bleeds. If I had a bleeding problem, I'd bleed. But nothing.
I haven't seen, Stuart, in the documents you've supplied to the inquiry, what, if any, Dr. Savage's response was. Do you know what it was? No. And then just continuing with this letter, we can see in the last paragraph reference to you being quite obviously jaundiced. It refers to the bilirubin tests and says, I suppose he may have Gilbert syndrome. No reference there, and this is the point you pick up in your statement, to the possibility that having been given both cryoprecipitate and factor VIII products in 1978, you might have been infected with hepatitis.
I wouldn't have known that because they told me about Gilbert syndrome, which is I believe the best way to describe it is a blocked tube on your liver, which causes you to get jaundice.
Your concern, as expressed in your statement, that at this stage, jaundice having been identified, hepatitis doesn't appear to have been considered by your clinicians. Now, we're going to have up on screen now a document that emanated from your school. It's 0653015. And it says this, it's addressed to Dr. Williams from the headmaster of your school. You may know that the county education officer has circulated a letter on AIDS to all head teachers. It mentions those children in Kent who are haemophiliacs, and the letter draws attention to the fact that many of them are known to have the antibodies of the virus which could cause AIDS. They have been infected by injections of factor VIII. Your patient and my pupil, Stuart Mclean, is a haemophiliac, and I should like to know, subject to your something ethics, whether he does have the antibodies, because in the county education office's letter makes it clear there is a remote risk of infection to staff and or pupils. You didn't know that letter was being written asking whether you had AIDS. And it's written on the erroneous hypothesis that you are a haemophiliac.
Correct. I must say, when I read that, when I first found out that they gave me Hep C, makes you feel sick, to be honest with you. That's my school, you know.
And that appears to have led, if we look at the next page, 653016, please, Henry, to a letter being written by Dr. Williams to your mother, inviting you to be tested for the AIDS virus antibody. We see on 0653017, please, Henry, Dr. Williams' response to the head teacher on the 24th of October 1985. And he says this: as you know, there's been a lot of discussion recently concerning haemophiliac school children who are positive for the AIDS virus antibody, particularly as to whether they represent a possible source of infection to their fellow pupils. I think a consensus view is now emerging with official backing that any risk of cross-infection is so remote as to be completely outweighed by the awful consequences of individual children being treated as latter-day lepers. and he refers to a publication by the Haemophilia Society. So that's his response to the general point. And then he says he couldn't give any information relating to you without the consent of you of your parents. You were then tested for HIV. You didn't know that. We've seen the correspondence to your mother, but you didn't know that you were being tested. You were, I think, 15 at the time.
Yeah, I didn't. I was nearly, going on 16. I didn't know, no.
And if we look at the letter at 06533018, and it's not a terribly good copy, if we could just zoom in on that. This is just to say that we tested Stuart on the 1st of November, and there's no evidence of infection with the AIDS virus or with the hepatitis B virus. So you were tested in relation to HIV, tested in relation to hepatitis B. Were you aware that you'd been tested in relation to hepatitis B?
No.
Do you know whether your mother was asked to consent to a hepatitis B test? We know she was for HIV from the looks of the correspondence. But
She never mentioned, in later years, she never mentioned Hep B, no.
And what you've said in your statement is this: it's clear that at this point, hepatitis had entered Dr. Williams' mind as a possible explanation for my episodes of jaundice, albeit despite the risk of non-A, non-B hepatitis being well known to haematologists at the time, there was never any discussion with me or my mother about the possibility that I could have contracted it.
Well, he's got the letter telling him that I'm jaundiced. He gets a letter from the school and he tests me for the AIDS virus and Hep B. And surely that must be in his mind as well, the jaundice being... He knows I've had the blood products now because he's testing me. So why wouldn't he?
And there was no discussion with you, or as far as you're aware, your mother, at any stage in the period that we're looking at, about non-A, non-B hepatitis?
None whatsoever.
If we move forward from 1985 to 1992, there is correspondence between your GP and Dr. Williams concerning episodes of jaundice and you being generally unwell. The documents are not entirely easy to read, but if we have 06533020, we see it's a letter dated the 29th of May 1992. It's from Dr. Williams to your GP. It says, thank you for your referral letter about this patient who, as you say, I know well. He has been jaundiced repeatedly over the years. And he refers to a finding first noted in 1984. It refers to the issue of bilirubin. It refers to your Ehlers-Danlos syndrome. And then says this: he's had a number of bleeding episodes, usually induced by trauma, e.g. playing football, being hit on the head by a stone or being chased by a bull.
Yeah.
You had an interesting childhood.
Yeah.
Do you recall, other than the bruising you've described, do you recall bleeding episodes?
The only one I can think of at that time was my brother. We used to play football, and he wore winkle pickers, and I went down to head the football, and he kicked me in the mouth, and that just split my lips, and that bled, but it was fine.
And it refers to that most of these episodes are avoidable. There's no specific treatment for the resultant bruising or bleeding apart from gentle strapping and local pressure. At that stage, May 1992, there's also reference, to jaundice, itchy skin and emotional ability. Were there any steps taken, as far as you know, either from your own recollection or your study of your medical records, by this time in May 1992, to investigate you for hepatitis C?
None whatsoever, no.
And that was 1992. Dr. Williams remained your haematologist until about 2004, 2005. And then you were not, I think, under the care of any haematologist in particular until 2012.
That's right, yeah.
And you then came under the care of Dr. Evans at the Kent and Canterbury Hospital.
Yeah.
And you saw her in December 2012 and again in January 2013.
Yeah.
And your statement explains that when you saw her, she raised a concern that she couldn't find any record of you having been tested for blood-borne viruses.
Yeah, she did mention, I mentioned to her that I'd been tested for HIV and Hep B, because obviously I found the letters, but...
And so she took some further blood samples for testing with your consent.
Yeah.
And the results came back in January 2013, is your understanding, and showed that you were hepatitis C positive.
Correct.
35 years after the treatment that infected you.
Yeah, that's correct.
You say in your statement that you are angry that for 35 years you've been infected with hepatitis C, and that you think there is no excuse for it having taken as long as it did to test you. Do you want to expand upon that?
They had all the evidence in front of them. You know, why did they give it to me in the first place? Then they see the jaundice all through the years. There was no bleeding history. They was aware. You can see from the letters they was aware, and they never did nothing. How can you leave someone like that? But they did.
I should say we have had a response from Dr. Nike to the concerns expressed in your statement. We'll come on to that at a later stage of your evidence. We're not anticipating a response from Dr. Williams. We do have a response from Dr. Evans in relation to matters that we're going to go on and consider now.
Yeah.
Or we'll consider in a few moments. But can I just ask you to tell us what your reaction was to discovering in early 2013, after all those years, that you had hepatitis C?
I don't know. My world just crashed. Because I thought Hep C, I didn't know what Hep C was. I thought it was for drug addicts. And I stood at a motorway bridge to end it all, because you just feel worthless, dirty. And it was just my grandkids that stopped me jumping. I'd like to say it goes deep in that, because I've heard stories, and can you imagine standing on that bridge and watching these lorries and that roll by, knowing which one to jump in front of? It destroys you. It absolutely destroys you.
You explain in your statement that having been given the diagnosis, you don't feel you were given very much information about hepatitis C itself at that stage.
I was given nothing.
You did your own research on the internet, and that was terrifying, because you came across story after story about liver cancer, how appalling the treatments were for hepatitis C, and you put it this way, I read horror story after horror story, and that preyed on your mind ever since.
Google's Google, isn't it? It goes to the worst case scenario on everything you put in. And that's all I kept reading, was one horror after the other. The treatments and everything.
You were referred to a hepatologist, Dr. Agarwal, at King's College Hospital. And in June 2013, Dr. Agarwal told you you had chronic hepatitis C, no sign of significant swelling or scarring to your liver yet. And then there was a discussion about treatment, including with interferon. What can you recall about that?
If I get this right, the first time he spoke to me about the treatments, he said there was the triple treatment. He said, but you've got a lot of other medical issues, and we could cause you more problems. So because your liver isn't damaged as bad, that we think we'll hold off on treatments.
And he told you, your statement says that there were going to be in the future new treatments with fewer side effects, and it was agreed that it might be sensible to wait to see what happened in that regard.
That's correct. Can I just say something on there? If this guy knows these treatments are that bad, why would they give them out? You know, but he wouldn't to me, but he'd give them out to others, and I've learned that through this inquiry. Why would he give them to people when he knows they're not? He's saying they're not safe. He'd give me a safer treatment.
You have raised in your statement a concern about the accuracy of fibroscans in your case because of your Ehlers-Danlos syndrome. Can you explain what that concern is?
I got talking to another victim of this scandal who's also got EDS, and she'd done a big study on it and saying that fibroscans, they've only got to hit one of my weak vessels and it can bounce the results elsewhere, so they're inaccurate. And when I was having my fibroscans, I was getting readings of 4.5 and then 6 and then 14 and then back down to 6, and it was just all different results. And then they took the lowest score and put that on my notes.
And you're concerned that whilst the fibroscans are recorded as showing no significant liver damage, that might not be, in fact, the correct position.
Well, again, after talking to other victims, enlarged spleen and a finely heterogeneous liver says otherwise. When you go on and read about it, it says different to what the fibroscan readings were, or as I understood it.
You relate in your statement that then in December of 2015 you saw Dr. Agarwal again and discussed the newer treatments for hepatitis C not involving interferon. Can you recall the discussion that you had with Dr. Agarwal on that occasion?
I was diagnosed with another medical condition called postural orthostatic tachycardia syndrome. And that is when I stand up, my blood pressure hits the floor and my heart rate goes up to 30, 40 beats a minute. So they put me on an unlicensed medication from America. Even my GP wasn't allowed to order it. I had to go to London to get it. And I asked him, had these new drugs been tested against it for interactions? And he said yes. But I'd already looked online at home because they've played Russian roulette with my life once. They don't get a second chance to do this. And I couldn't find nothing. So when I asked him, he said, I'll show you. And after about 5 minutes, he couldn't find it. And he turned around to me in front of me and my 5-year-old grandson. And he said, if you don't want the treatment, and I'm sorry about the language, get out my fucking hospital. That was his words to me in front of my 5-year-old grandson.
And I should say, sir, that Dr. Agarwal has been asked to respond to Stuart's statement, and it is anticipated that we will receive a response, but we haven't yet received it.
And I just say on that as well, I reported him to PALS, and to this day he hasn't responded to PALS neither.
We'll just look at a letter that Dr. Agarwal wrote to your GP after that consultation. It's 0653022, please, Henry. It says this, I met this gentleman today in the context of his consultation around hepatitis C. I'm sorry, but I did not feel that we've offered him a good consultation today, given his frustration and bitterness around his route of infection. He has mild disease as evidenced by his fibroscan of 4.1. He is specifically requesting an ARFI because he would like to delineate that this may demonstrate that he has significant underlying fibrosis, and I presume trigger an additional compensation. From my clinical perspective, reviewing his liver test and fibroscan in association with his imaging, I think it is unlikely that he has any significant liver disease, and thus I do not think he will make the criteria to get the additional pay. Clearly, this will be an additional frustration as Mr. Mclean feels his life has been ruined by the acquisition of hepatitis C. And then it goes on to talk about therapies over the page. We see there Dr. Agarwal saying that he presumes your concern was to get additional compensation. Was that discussed with you by him?
He said to me, if you don't trust what in a consultation, you don't trust what the fibroscans are saying, I will never sign you off as stage 2 anyway.
Had that been your primary concern at that stage, or was your primary concern finding out the state of damage to your liver?
I wanted to find out what damage had been done.
And you observe in your statement that the assertion you'd not had a good consultation was a significant understatement.
Yeah.
You don't, I think, quarrel with the description of you as being frustrated and bitter. You say you feel completely entitled to be bitter about being infected with a life-limiting virus by the NHS on the basis of a misdiagnosis when even if the misdiagnosis was correct, I could have been treated with a completely safe alternative.
Not going to skip down the road and be happy, am I?
At the time you prepared your statement, you said that you had not undergone any treatment for hepatitis C, you don't know what state your liver is in, and you live in constant fear that your liver's been significantly damaged and that you could develop liver cancer at any time. Is that still the current position?
Yeah, I still haven't had treatments. I don't trust their treatments. Somebody hit on it the other day when they said these trial drugs, they want grade A patients for their trials to give them their tick. They don't want grade Z with people who've got a lot of illness. But they'll pass that drug and then they just give it out to people like me with grade Z, who ain't a grade A, with a 24-hour hotline. I don't trust the NHS. I will never trust the NHS again. They've done too much damage.
You put it this way, I have no faith in the NHS. My treatment over the course of the last 40 years has been a comedy of errors which has not been in the least bit amusing. I have variously been congratulated on clearing HCV despite having never had treatment, the doctor having assumed that I'd been treated. Doctors still refuse to accept that I do not have a clotting disorder, and I am still spoken to as though there is a distinct possibility that I did not contract HCV from blood products. Can I just ask you about that last observation? The suggestion that you have been spoken to as if the source of your hepatitis C was something else. Can you elaborate on that?
I don't know. I don't know what she meant by that. I really don't. This is a hepatologist who should know that people given factor VIII products, 100% would be infected with hep C. She seems to doubt that.
When you say she,
Yeah.
who are you
the
referring
doctor
to?
who
Dr.
was in-
Evans or
No, the
Dr.
doctor.
Agarwal?
Yeah, who was in that consultation.
Okay, thank you. So it's the lack of a correlation that the doctor's making that the cause of your hepatitis C is the NHS treatment, and understanding that then influences your approach to further treatment.
Yes. You know, you're probably going to come on to the letter, but I go in to this same doctor and he says, I'd just like to say, well done on clearing hep C. It's brilliant. You must be so happy. And I just looked at her dumbfounded and said, what are you talking about? And then she looked at her computer screen and said, I'm really sorry, I'm reading the wrong person's notes. How do you make that mistake? And they wonder why I've got no trust in them, why I've got no faith in them.
Now, in November 1992, you had surgery
Yes.
for which you were treated with tranexamic acid and DDAVP on a prophylactic basis. You did bleed after that operation. That was, as you understand it, because of a surgical error in relation to the sealing of a blood vessel. But as a result of having bled, you were, on the 11th of November 1992, given 4 units of fresh frozen plasma. You healed well, and for many years you thought nothing further of that particular medical intervention.
Never heard of hep C or nothing, and I didn't know, because I'd had the AIDS test, I didn't have AIDS, so, you know...
But the significance of the treatment you received in 1992 then became apparent to you only in 2013 when Dr. Evans wrote a letter to your GP which referred to variant CJD. And we'll just look at that, Stuart. It's 0653025. So we can see it's a letter from Dr. Evans to the GP. It refers to reviewing you. Again, it says, cannot find any evidence of haemophilia. I think the most likely explanation for his bleeding and his joint pains is the Ehlers-Danlos syndrome. It refers to you being infected with hepatitis C as a consequence of treatment with blood products. And then it says this: I will try and obtain some information about his previous treatment so that he may apply to the Skipton Fund for compensation for his hepatitis C. As he has had treatment between 1980 and 2000, it is possible that he is at increased risk of new variant CJD. However, I think the guidelines for this are changing and he may not be at risk. Therefore, I have not informed him this at present, but clearly if he needs any surgical procedure, then we will have to consider this. I am awaiting further clarification from the Department of Health on this issue. So we can see from this, and your statement says, that when you saw Dr. Evans on this occasion, she didn't mention variant CJD to you.
No.
But you saw this letter because by mistake it was sent to you.
If you look, if you scroll up a little bit. No, the other. There you go. There's my doctor. That was the address which should have gone in the envelope. But underneath it's got R.E. Stuart Mclean, and then it had my address, and it come to me by mistake. They put the wrong address window in the envelope, and I got it instead of my doctor.
And so you understood when you saw this letter that it may be the case that the plasma you received in 1992 for that surgery that you'd forgotten about over the years because it hadn't otherwise been significant may have led to an exposure to variant CJD.
Yeah, that's correct.
You recollect in your statement seeing Dr. Evans not long after this, you then saw her later, but you asked her why she didn't tell you that, and she said something to the effect that she wanted to find out if you were at risk first.
I was a 43-year-old man. That wasn't her choice to make. She could have been up front and she could have told me. I wasn't under 60, 43, and this doctor knew my history. And she knew I'd been lied to for all these years by not being told. She blatantly carries on.
We'll come on to the rest of the correspondence with Dr. Evans and indeed Dr. Evans' response to your concerns in a moment. But just keeping chronologically, that was 2013. In 2014,
yeah,
you had an appointment at the National Prion Clinic with a nurse consultant.
Yeah.
What can you recall about that appointment?
Again, that was at Queen Square. And what I can basically remember from that was that I was told that VCJD, there was no tests for it. And if I did get it, I'd be dead in 6 months anyway. So try not to worry too much because there was a remote risk anyway.
And you've not, I think, heard anything further from the National Prion Clinic
Absolutely.
since that meeting in September 2014?
Nothing, no.
You've said in your statement that it was listening to witnesses in the early stages of the inquiry hearings earlier this year that brought CJD back into your mind. You pushed it to the back of your mind because you were focused on the hepatitis C. And so you went to see Dr. Evans again in May of this year.
Yeah.
What can you recall about the consultation and discussion you had with Dr. Evans in May?
I asked her why she thought it was irrelevant to not tell me at the time. And she said to me in front with my wife that I was in a bad mental state, an emotional state, and she thought it was best that she didn't tell me that result because I'd just been told about the hep C.
She also told you when she saw you in 2019 she'd not been able to obtain batch numbers for any blood products that had been given to you in 1992.
That's correct.
And if we just look at the letter she wrote following the consultation, it's at 0653026, please, Henry. She says this in the long paragraph: I understand that you're upset that you feel I did not warn you about your possible risk of new variant CJD when I saw you on the 13th of February 2013. This was the first appointment that we'd met, and at that stage we just informed you that you'd been infected with hepatitis C virus following previous treatment at another hospital. At that stage, it's clearly documented that I stated I would try to find out some further information about your previous treatments. I also thought that as you may have had pooled clotting factor concentrates between 1980 and 2000, and therefore stated in the letter that it was possible that you were at increased risk of new variant CJD. I did not inform you of this possibility at that stage, as I wished to obtain further information about what treatments that you'd had in the past, rather than worrying you unnecessarily if you'd not been exposed to the relevant products within that timescale. However, it was important that I documented this in your notes in case you required surgery in the near future. I'm sorry that you feel that I should have warned you of your risk at an earlier stage, but I did not feel it appropriate to worry you unnecessarily until I had further clarification of whether you were at risk, particularly as there was no test to be performed at that stage to determine if you were at risk, and there was no impact on your current health at that stage or likelihood of transmitting any infection to other individuals other than through surgical instrumentation. Once we had established that you were possibly at risk of new variant CJD, I reviewed you in clinic and we discussed it in some detail. And then it refers to you not being, your concern about not being given the choice to know for yourself.
Exactly.
After your consultation with Dr. Evans, you wrote to UKHCDO to try and get yourself details of any products administered to you. What were you told by UKHCDO?
They said they'd have to come back to me because they've got to look on their computerised system. And then I did have correspondence saying that they found nothing. All it had was my name, but there was nothing. It was blank, 4 pages of blank paper. And then they said that they will go through their paper archives, which again has come back as nothing.
And you say in your statement, I was told it seemed that Dr. Nike had never notified UKHCDO of the products which had been administered to me. And you say UKHCDO told you that their records were only as good as the information that was provided to them by the hospitals.
Correct, yeah.
You also say that the doctors who treated you in 1992 didn't notify UKHCDO of the plasma you were treated with, but you understand that a little more because they knew that you weren't a haemophiliac and didn't have von Willebrand's.
That's the way I perceive it. That's my fault that they knew I wasn't a haemophiliac, so they didn't have to send it.
But because there are no records, you have no way of establishing whether you have received any particular batch of product that exposes you to a risk of VCJD.
And by the looks of it, I'm never going to know.
And I should say, for the sake of completeness in relation to this issue, that there is a statement from Dr. Evans. I'm not going to put it up on the screen, but it's right that I note that she's responded to the criticisms in your statement. She has explained that her thinking was that she wanted to get further clarification about whether you were at risk before worrying you unnecessarily, essentially as she set out in her letters. And that statement will be published on the inquiry's website alongside your evidence.
Can I just say something on
Yes,
that
of course.
statement? And it is, she writes in her statement that she informed me I had Hep C. Dr. Evans did not inform me. My GP phoned me up, and his phone call, and I remember it vividly, and he said to me, you need to come down and see me, because I got on well with my GP. He's a very good doctor, and he was an ex-barrister. He said, you need to come down and see me, but you need to bring someone with you. That lovely word, bring someone with you. And I put the phone down and said to my wife, this ain't good. It was my GP that told me I was Hep C, so how would she know what state I was in, mentally and physically, because it was my GP that told me.
What she says is there was no intent on my behalf to withhold the diagnosis, but to make sure with thorough checking that the information was correct as far as I could determine from any records available, I was concerned about the witness's mental health throughout this period. I was not being arrogant withholding information, but would not wish to cause harm by giving incorrect information without checks being made regarding previous treatment. And as I understand it, your response to that, Stuart, is that it was still your right to know.
43 years old was my right.
Can I ask you what the mental, psychological, emotional impact of the events that we've been exploring and the diagnosis of hepatitis C has been on you?
A lot of people have done it before me. It destroys you. It's destroyed my career, my life, my marriage. Yes, destroyed my marriage, but it's not the same. Everything is, they took a lot away from me for no reason, and that's what I can't deal with. It's why? Why did you do it? And it just took the whole, everything I had away from me. I had the best job in the world, and it's just, you're left to just get on with it. You're another statistic, as I'd say.
You, as I understand your statement, Stuart, you find it very difficult to get your head around the fact, for want of a better phrase, that you were given a treatment you didn't need for a condition you didn't have.
Yeah, since this inquiry, I've been listening to the haemophilia community, and they'd be given cryo, and some would be given it for 7 days or a little while, and then they'd be moved on to another product if I had a reaction or if it wasn't working properly. This lady gave me all 3. It was like, have that, and for good measure, let's make sure I infect you and have that. I can't get my head around that.
You spiralled into depression after your diagnosis. And you say in your statement you felt and sometimes still feel worthless and dirty.
Yeah.
You've told us about standing on top of a motorway bridge. Yeah. You're dependent on antidepressants. Your moods are erratic. You have bouts of uncontrollable anger.
Yeah.
And we have a statement from your wife, from Karen, just described the impact on you and on her and on your relationship. You also, in the cul-de-sac in which you live, have had neighbours, previously your friends, discovering that you had hepatitis C, and you've had a neighbour scream at you that you were an infected hepatitis cunt.
Yeah.
I
then had to go and explain to my neighbours how I caught Hep C. And that was the hardest thing you ever have to do, is trying to explain yourself for something that you didn't do.
And you said in your statement that those neighbours, despite your explanation, don't speak to you now.
Hardly, no.
You've referred to the impact upon your ability to continue working. You were signed off work sick after your depression and ultimately made redundant, and you haven't worked since then. You feel fatigued, and you feel like less of a man being unable to financially support your family.
Yeah, that's fine.
You pay testament to your amazing, that's your description, wife, pillar of support, but you feel you've burdened her.
I do, yeah. My wife has taught herself before we met. She didn't need this on top of all that. She just didn't need it.
And you've said in your statement you feel like you betrayed your wife because she married you whilst she thought you were healthy and then discovered too late when you had hepatitis C.
Correct.
In terms of counselling, you had, I think, a couple of counselling sessions provided through the Hepatitis C Trust, and paid for by the Caxton Foundation, but it wasn't of any great assistance.
No, obviously you have to tell them your story, and I'm sorry to that counsellor, but the nodding dogs you get in the car, it was like I was talking to one of them. It was just, she was reading it like a horror story and just didn't understand it.
When you received the stage 1 payment from the Skipton Fund, what did you use most of it for?
We'd had a family incident where my blood got spilled in the house. So because of my Hep C, I stripped the house out in fear because I didn't understand Hep C at the time. And I just didn't want to contaminate my family, so I stripped the whole house out and threw everything away and renewed everything.
And you describe in your statement having made an application, I think, to Caxton for a new pair of glasses. What happened in relation to that?
I'm under 7, 8 hospitals, ranging from Middlesex down to Canterbury, and I can't drive without my glasses. And they broke, and I asked them for a new pair of glasses, and they said, you have to put in the 2 quotes. And then it'd go to the board. Well, I just had a meeting, and at the time, the meetings were 6 to 8 weeks away. And I said, I can't wait. They said, you're going to have to. But I had hospital appointments to get to. So I thought, I'd go and buy the glasses, and I'll put the receipt in. And they wouldn't reimburse me for them. They said, no, you've gone ahead and done something that isn't protocol, and we're not reimbursing.
You've made 2 other observations in your statement about the funds and schemes. The first, in relation to EIBSS, you're recognised as a stage 1 infected beneficiary, is the way you put it in your statement. And you saw their literature saying that the funeral plan funding was available to both stage 1 and stage 2 beneficiaries. So you approached EIBSS, but what were you then told?
I applied for the funeral grant because when it went up on their website, it come up that stage 1s and stage 2s could apply for the funeral grant. So I took a picture on my phone and I applied, and I got told no. I then said to them, but you've advertised it, so you have to honour that because you put it up. And I sent a picture into them, and they said, we'll come back to you on that. And the lady did come back to me. Am I allowed to name her?
It may be better not to name her for present purposes. You can perhaps tell us later and
Yep.
see whether we need to obtain any further information.
And she come back to me, and her exact words to me on the telephone were, we will honour it if you tell no other stage 1 victim you've had this funeral grant.
And you had been told that the literature they'd put up was a mistake because the funeral plans were only intended to be available for stage 2 beneficiaries.
Correct. Yeah.
The other observation you've made in your statement about the schemes, and again we've heard it from others, but you make this point, about the disparity between the support mechanisms across the United Kingdom.
It's embarrassing when you look at their website. You know, you've got the widows out there who look after us for free. Dark times, everything. They get us through our darkest times for free. And there's nothing for them. There's just nothing. It's shameful. It's absolutely shameful. And my friend, he mentioned in his statement, they never gave us these diseases in stages. What's the stages about?
You've put it this way in powerful terms in your statement, Stuart, and I'll just read it if I may. Why is the value of your life different depending on whether you are English, Scottish, Welsh or Northern Irish? And why is your life worth so much less if you were British rather than Irish? The last topic I wanted to deal with, Stuart, is the response of Dr. Nike to the criticisms in your statement. We have a statement from Dr. Nike. Henry, it's 380201. We can see from paragraph 4 of that statement, bottom of that page, that her essential response to the core criticism you've levelled at her about giving you those treatments is, I don't recall 40 years later who I spoke with at OHC, that's Oxford Haemophilia Centre, but putting all information available at the time together was advised by OHC to treat with all 3 available products. And she says that elsewhere. She says, I have not treated Mr. Mclean wrongly. I did the right thing as advised by Oxford Haemophilia Centre. She accepts no wrongdoing and says she was never told by the Oxford Haemophilia Centre that the results they provided were not reliable. So that's her response to the substance of some of your concerns, and her statement will be published on the website. We'll keep it up, please, Henry, as well. Will be published on the website in due course. I'd like to go to the last page of the statement, please, Henry. And could you zoom in on paragraph 19, first of all? So it refers in paragraph 19 to Dr. Williams and his resurrection of the diagnosis of von Willebrand's. And then it says this: doctors are not certain and keep on the same treatment given 40 years ago, exclamation mark. Mr. Mclean, wake up and accept the inevitable. Doctors are scientists, not almighty gods. Now that's what Dr. Nike says in that paragraph of her statement. And then could we have, please, paragraph 23, Henry? When she says this, she refers to a point you've made in your statement about biopsies, and then says this: doctors avoid him, that's you, not because he is dirty, but he is rude, demanding, and exhibiting unacceptable behaviour. Doctors who dare to speak truth have witnessed his outbursts. One doctor kicked him out of his facilities. Doctors have many patients to take care of. Mr. Mclean is a grown adult and needs to have anger management. Just wanted to home in on that second sentence with you, Stuart. Doctors avoid him not because he is dirty, but he is rude, demanding, and exhibiting unacceptable behaviour. First of all, as I understand it, you were last treated by Dr. Nike in the late 1970s, when you were a child.
Yeah.
Have you been treated by her or seen her since that time?
No.
Secondly, you have been particularly upset, I understand, by the phrase, because he is dirty. And the reason for that is because that is how you have thought of yourself since you were diagnosed with hepatitis C.
Correct.
Now, it's right, I should point out, that there may be more than one way of reading that sentence. It could be read that the doctor is saying you are not dirty, but you are rude, demanding, and exhibiting unacceptable behaviour. Or it could be read as saying you are dirty, but that's not the reason doctors avoid you. You've read it in the latter way, but either way, that sentence in this statement, I understand, has greatly upset you.
That's why I stood at that motorway bridge, because I'm dirty, because of what she did to me. And it says, the English language, he is dirty. Not doctors think he is dirty.
Stuart, those are the questions I have for you. Before I ask you if there is anything you'd like to add, I'm going to ask Mr. Stuart.
May I just
Yes,
ask? There is a highlight in the sense of bold type being used. It looks plain to me from what lies underneath the extract we can see on the screen that is in the original statement.
That is not a highlight.
So the bold is put on by Dr. Nike herself.
Yes, that's my understanding. This is the form in which the statement has been received from Dr. Nike.
So these are the emphatic points she wishes to make.
One assumes so from the use of the bold,
Yep.
sir. There's no further questions from your counsel. Is there anything, Stuart, that you would like to say?
I do, yeah.
Yep.
Okay. Sir Brian, I'd like to ask you, please, to put a stop to this. Stop us having to go cap in hand, jumping through hoops to schemes. We have no knowledge of what we, the victims and families, have gone through and are going through. Ibs and their predecessors show no care or compassion about our plight or our suffering, and I would like to ask you to make interim recommendations as soon as is possible. Because if you wait to the end of this inquiry, the government can choose to ignore your recommendations and continue to ignore the infected and affected victims as it has done for the last 40 years. I think we've all suffered enough. If you decide to make interim recommendations as soon as possible, then we can all look at the response from government and comment on the progress they make. If you do this, you might start to see and feel the frustration and anger we victims all feel against the state, but I feel that they would probably ignore you as well. I was an 8-year-old child when the government NHS, in my opinion, deliberately infected me with hepatitis C for no reason. I've been given a death sentence. And when I die, their crime will be complete. I never had a bleeding problem. And what my consultant, Dr. Naik, did when I was 8 is completely unforgivable, and she should be held accountable for her actions. I find Dr. Naik's recent statement both repulsive, cruel, and with no remorse or empathy. My haematologist, Dr. Williams, I trusted for over 20 years, and he conspired to hide the truth from me, and I cannot forgive him for that. I believe, as an 8-year-old child, this was child abuse and neglect to a minor by both of them. Maidstone and Tunbridge Wells Health Authority have been complicit in this scandal because they've either destroyed my batch numbers of the blood products I received, or failing to hand them over to me, or worse still, did not record them, and I do not know if I've been exposed to CJD. My current haematologist, Dr. Evans, who disgustingly withheld the results from me in 2013 as she thought it was in my best interest, as she said I was in a vulnerable state after she told me I was Hep C. She didn't even tell me my results. My GP did. So how would she know what state I was in? These doctors today still haven't learned any lessons from the mistakes of this terrible scandal. I apologise for the language in this bit, but one consultant at King's College Hospital London told me when I raised concerns about treatments to get out of his fucking hospital in front of a 5-year-old child, his hospital, how arrogant is that, continuing today in these hospitals? And he's refused to answer to pals as he believes he's above the law. We as victims have had successive prime ministers ignore us and bat us away like we are scum. One even saying, tell victims to apply for grants from the National Lottery. The likes of Matt Hancock, Jeremy Hunt, one a recent health minister and one a current health minister, refuse to even mention us victims or engage with us. And as you've seen in the news, even lie to victims. We continue and are still today their dirty little secret. And governments previous are culpable and complicit of this scandal on a grand scale. Today's present government continue to cover it all up. The very people we voted into Parliament to protect us. But because we allow them to, they continue to and deliberately mislead the public and can never give straight yes or no answers and back questions away as they believe they are superior to us and believe why should we answer these victims, their dirty little secret. Well, let me tell you, Mr. Johnson and Mr. Hancock, we are not scum and we're not your dirty little secret. We are victims of a dirty big lie, deceit, and we as victims are put secondary to money, profit and ethics. But while I and other victims and their families still have fight in our bodies, we will not give up telling the world what these shameful governments, past and present, and the NHS did to us, and their continued stance of no liability. And we have been their dirty little secret no more. The reason I'm here alive today is because of my grandsons and my wife, who has been my rock, and got me through some very difficult times and still does. They were on my mind that day at that motorway bridge. Moving on to IBS and their once a month payment. The England Infected Blood Support Scheme. Such a shit name, by the way. And my prison number, PB 8276. Like I'm a convicted criminal in prison. It's disgusting and in part shows the contempt they treat us with. To IBS, my name is Stuart Mclean, not PB 8276. And because of that personal number they gave me and others in the Department of Health's little scheme, I'm reminded every month for the rest of my life of what they've done to me. The victims alive and the victims, families of the victims who have died. We want compensation, we want justice, and we want the truth, as this government has lied for too many decades. So what do I want? I want the truth, why these doctors did this to me. I think I was deliberately infected, I was mistreated, I was misdiagnosed, all because of Dr. Naik was too arrogant to listen to specialists who months before told her I had no bleeding disorder. I want all the doctors in charge of my care to be investigated, and if the inquiry finds them to have acted improperly, I want a recommendation that criminal proceedings should be taken against them. They should not be allowed to get away with this. I want the government's role in this scandal to be exposed. I don't understand how implicated politicians can go home at night, tuck their kids in, and not think of us victims. Many of us were children. The very least government can do is stop burying its head in the sand and making the victims go through even more trauma. The time has come for government to do the right thing and admit liability and compensate everyone infected and affected and give us the truth. But I'm guessing, as per decades before, no answers will be forthcoming from them. So I'd like to challenge Boris Johnson. Sit down with us victims and hear our stories face to face, and then continue to treat us in this way. Finally, I'd like to thank a few people. Firstly, my wife, who's my rock, my carer, and puts up with my dark times and moods. And to all widows and carers of us victims, they are discriminated against. They get no thanks, no nothing for their continued support and care they give us victims for free, saving the government millions of pounds a year. And it's about time they were recognised. I'd like to thank my team at Milner's. Wow, Sam, Ben and Nathan, just brilliant from the start. And Sir Brian, Jenny and the whole inquiry team for their hard work and patience. I appreciate hearing all the witnesses and reading all the statements must also take its toll on you. So a very, very big thank you.
Thank you, Stuart. Sir Brian.
You described what happened to you in the course of your statement and indeed your evidence as a comedy of errors. To me, it seems more like a tragedy of errors. Well vouched, well detailed, and it's a remarkable story which needed to be heard. So thank you for that. But also, I think part of the evidence is not what you have told us happened to you, it's the way you've told us, which is in itself remarkable, that you have managed, despite talking about potential suicide, despite talking about your dark moods, despite detailing everything that was done to you for what you see and others may well see as no apparent reason, you managed to keep it all together and given your evidence with what some may see as remarkable restraint. Your anger came out at the end, but it might well have come out at any stage. And I think the way you've told your story is as much evidence as what you were saying. Thank you. Ten to 12.
Excellent.